is the sixth workshop event that we're having. I'm just going to do a very brief introduction. My name is Clover Rodriguez, and I'm a policy officer at the Welsh Local Government Association. So for those of you that don't know the WLGA actually represents the 22 Welsh councils, and I'll just be kind of chairing this session, very loose term of chairing. So I thought I could just start with a few minutes of context about the background of this program and a little bit of shameless PR about the partnership as well, if you'll allow me. So recovering from the COVID pandemic is one of the greatest challenges of the next decade. And the way in which public and third sector agencies and communities work together to respond to COVID often served to mitigate the worst impacts of the pandemic, and in many cases brought hope and support to people in severe need. And in some cases, this work was entirely new. And in other cases, we were building on existing work and relationships developed before the pandemic. In all cases, what we've done is it's offered lessons and ways of working that many people and organizations want to continue and build on. So the Community Resourcefulness Partnership, sorry, I stumbled over that because we changed the name, but it's called the Community Resourcefulness Partnership. It's a national forum for public and third sector organizations. It's a practitioners forum. It's hosted by Social Care Wales and includes representation from local authorities, community and town councils, academia, community, health, and the voluntary sector. So what it aims to do is enhance community resourcefulness, improve this way, this cross-sectoral working. It recognizes the importance of local assets and local solutions. And of course, contribute strongly to key government priorities through the Social Services and Wellbeing Act and Future Generations and Wellbeing. So the partnership, as I said, is the only multi-agency national practitioners forum in Wales. And what we aim to do is cover the full range of policy areas where co-productive working between communities and the public sector is important. So quite a vital forum for building on this constructive co-working practices that we've seen during the COVID response. So although many of the practices showcased in this program have originated from a health and social care focus, other services, in particular environment, economy, housing, are integral to citizen and community well-being and building this community resourcefulness. So this program of events, it marks the official launch of the partnership. It's the beginning of our collective aim to share and disseminated approaches, which widen and deepen co-productive practice, which are essential as we rebuild our society from a major health disaster. There's also something about rebuilding after deep-rooted inequalities, the rise of cost of living, that's very topical at the moment, the climate change, and future budget restraints. So if you're at this event, you will be interested in being a member of the partnership, because what we're trying to do is learn and share, create networks, influence policy and practice. And if you are, please contact Emma Davis. So so Kate, could you put Emma's contact details in the chat? Just email Emma and she'll make sure you're included on the membership list. So before I introduce the team delivering the workshop, just the usual housekeeping rules. You probably heard this over and over again. This is an interactive session, so please use the chat function throughout. Keep your microphones on mute when not speaking. You're welcome to keep your cameras off or on. Type questions in the chat or use the raised hand functions. A reminder, this event is being recorded and be shared later this week, along with any presentations and resources. And finally, we have a very diverse group of delegates here, so feel free. In fact, I really encourage you to tweet using hashtag #CommunityPowerWales. Kate, could you please post the hashtag in chat? And let's share the love. Okay, so let me introduce you to the workshop facilitators. So like most of colleagues who are here today, I was involved in the early days of the pandemic and have witnessed then and now public and third sector organisations in their community doing what they do best. This event will look at how the CVC empowers in collaboration with the local health authority, the local authority and the local health board, were able to respond to the COVID-19 pandemic from the initial outset to now. So the workshop will cover issues such as how communities and volunteers have played a key role in the delivery of support, how they met the challenges for delivering COVID-19 support, and the delivery of the mass vaccination programme in a rural county. How the community sector response group covering all 13 Powys localities were formed, building on the learning and positive partnerships work during the pandemic, and how this now acts as the Powys Social Value Forum. The workshop are also going to cover initiatives that will sustain these benefits, such as the Health and Care Academy Skills Hub for training and support for anyone looking to start a career in health and social care, and embedding social prescribing as an approach. So this is an interactive session. Post your questions and comments in the chat bar, and we'll do our best to get to everyone. So over to the two Claires and Sharon, who will take you through their story. Thank you very much.
Brilliant. Thanks ever so much, Clover, and welcome everybody. It's nice to have so many people on. Monday morning is always a challenge, isn't it? But it's great that you're all here. And hopefully as well, we can share the recording after and encourage more people to listen in. So please share it with your colleagues when it's available. It's really great to have my colleagues Claire and Sharon with me today. We've been a pivotal part of the team in PAVO in supporting communities and taking this work forward. So we're going to share a presentation with you, and we've got a couple of questions we're going to pose to you. We've got a little bit of a video to share as well. And as Clover said, please do put your hand up for any questions you might have, or pop them in the chat pane, and we'll endeavour to answer them as best we can. So this is where it gets tricky, because if you're anything like me, technology, I always worry that it's not going to work. So we shall give it a go, she says. And hopefully you'll be able to see the slides, but not my notes. Is that right? So Sharon, I can see you.
I can see your notes, Claire, as well.
Oh gosh, right, okay.
No, that's it. Well done.
But I can't see my notes now, Shar. That's the problem. Okay, well, I'll try and fix that in a minute when the video is playing. But first of all, just to give you a bit of background context then. So right back before the COVID pandemic, we were already working in partnership with Powys County Council and Powys Teaching Health Board, and we're a member of the Regional Partnership Board. Very much part of that partnership board to give the voice of the community sector, the third sector voluntary organisations. And just to give you a bit of background context really, so when I started in PAVO some 5 years ago, we already had community connectors, although they were called third sector brokers at that time, of which there was 2 people covering the whole of Powys. And we were really trying to build on that importance of third sector and third sector offer. I often say that back 5 years ago, I did used to feel that I was sometimes on my soapbox with my hand up going, don't forget the third sector. And I'm sure some third sector colleagues on the call today will probably appreciate that and understand that. But certainly in those 5 years, and in particular with COVID, that relationship has really developed and built. And when people ask me, what do you think was the reason for that? I say it's been built on consistency of approach and the offer, and building relationships and building trust in the voluntary sector and what we can do to support people's health and well-being. So now let's see if I can turn this over. This is nothing. So now I'm going to show you a short video, and I hope now you're going to be able to hear the sound. So here we go.
So, what is PAVO? Beth yw PAVO?
Mae Cymdeithas Mudiadau Gwirfoddol Powys yn darparu gwasanaethau hanfodol mwyn cefnogi sefydliadau trydydd sector ac I wella bywydau pobl.
Powys Association of Voluntary Organisations provides essential services to support third sector organisations and to improve people's lives.
PAVO aims to be a catalyst for voluntary action in Powys.
Nod PAVO yw I fod yn gadlydd ar gyfer gweithredu gwirfoddol ym Mhowys.
We want all voluntary organisations in Powys to have the skills, knowledge and confidence they need to thrive.
We aim to enable innovation and help groups to develop new services to meet the needs of their communities.
We want individuals to be able to achieve their personal goals and contribute to their communities through volunteering.
PAVO aims to provide a voice for voluntary organisations and community groups.
Nod PAVO yw darparu llais a rhan mudiadau gwirfoddol a grwpiau cymunedol.
We want the views of individuals and communities to be heard and understood by decision makers.
We want the third sector to be able to engage meaningfully with public bodies.
And for public bodies to recognise and value the contributions of voluntary groups.
PAVO aims to be a hub of essential information and resources for the third sector.
Nod PAVO yw bod yn ganolbwynt gwybodaeth hanfodol ac adnoddau ar gyfer y trydydd sector.
We want the third sector in Powys to be well informed and have access to the resources they need.
We want voluntary groups in Powys to have opportunities to learn from and support each other.
We want more individuals to achieve what matters to them through connecting with third sector services.
We are PAVO.
PAVO ydyn ni.
There we go. So that gives a small snapshot of what we do in PAVO. And talking of snapshots.
So, what is PAVO? Beth yw PAVO?
Right. Bear with me. Sorry. Right, there we go. Okay, I will get it right eventually. Okay, so a snapshot of Powys. I'm sure many of you have been to Powys or driven through Powys. Very rural county, as you know. It takes us a good 2.5 hours to drive from the south to the north, which brings its own challenges in terms of delivering services, and also in terms of staff recruitment, where people are based and all those kind of issues. And it gives you a bit of an idea there. So our population is around 132,000 people spread across that wide area. And we've got the working age population there and then older adults. And of course, it brings its challenges in terms of people often leaving the county for work, and an older population that's growing within the county and delivering support to individuals that are needed. We do have I think it's a benefit of having one health board, one local authority, one CVC under the Regional Partnership Board. That does certainly help in terms of communication. But just as an idea, how many voluntary organisations do you think there are in Powys? And we're going to have a little poll question up here, which hopefully will pop up in a second. There we go. So there we are. So how many voluntary organisations in Powys? Less than 1,000. 1,000 to 2,000, 2,000 to 3,000, over 4,000. So have a little bit of think of what you think there are. Obviously not all members of PAVO, but we aim to support the whole sector as and when required. There we go, we've got 20 answers so far. Any more? Yeah, a couple more coming in, brilliant. Okay, we'll go with that then. So, so 4 people think less than 1,000. It's more than that. And I know Sharon got a real answer a lot lower than that the other day, didn't you, Sharon? Okay, so 1,000 to 2,000 was the highest answer. That's not correct either. It's actually over 4,000 voluntary organisations in Powys. And that is from your little tea and chat group, your community group, right up to the bigger organisations in the county that offer support. So for us as PAVO, that brings a challenge in terms of knowing what's going on and what's happening out there. And it also, in terms of support, so Claire, that's on the call with us today, is part of our development team. So it's offering development opportunities for those groups, whether they want to grow, if they need support in terms of setting up their constitution or policies, safe volunteering, and also in the cases which do happen is around helping those organisations as well to close with dignity if they've decided they no longer wish to continue. So it's about offering those support to those organisations and knowing what's available so we can support people through the health and care system as well. Just click share results there. Right. Okay. So the emergency response and how did we respond to that? So we all know what happened in terms of COVID hitting us and what that was. Well, we were trying to imagine what it might look like. So we had a call one day from a colleague on the regional partnership board, asked could they come and speak to Carl, our chief exec, and myself around what they are anticipating might happen and how we might support them through the voluntary sector. So it was really early days and we were thinking about how could we do that, what would the impact be? And we really had to turn things around on its head as we began to understand the full impact of COVID and what that meant for our communities. So within PAVO, we had the Community Connector service, which are covering the whole of the county, and we also had the befriending service and the development team supporting volunteers. And we decided to set up the CSIRT group, which was the Community Sector Emergency Response Team. And that was made up of PAVO, health boards and local authority colleagues. And we met on a weekly basis. And in fact, out of that came an invite to attend 3 or 4 times weekly, depending on the demand, meeting with health and social care colleagues to understand the demand that was coming through the doors as well. So we were really part of that team and a really cohesive partnership team right throughout the pandemic. So we supported individuals, and Sharon will probably touch on this now. I'm going to hand to Sharon to talk about how we had to redeploy staff within PAVO to manage the demand and how we supported the local authority in particular around people that were shielding. So I'll just hand to Sharon.
Thanks, Claire. Yes, it was quite an intense time, and I'm sure a lot of you experienced it as well. So as Claire said, we'd already had established the Community Connector service, 13 community connectors working in locality areas across Powys. Those connectors have an awful lot of local knowledge and local contacts within the third sector, but also linking with health and social care. They were the eyes and the ears on the ground of who was responding in which community to help support individuals. So through the Community Sector Emergency Response Team, we were aware through the Community Connectors of 112 community COVID response groups were set up in local areas. They were vital to the support for individuals. They were the groups that we would go to when requests would come in through from health or social care of an individual that was struggling in their community to access shopping, prescriptions, posting a letter, or just welfare concerns. It was those 112 community groups that we turned to get the support for those individuals, and they responded. As a Community Connector service, we're always looking for support for individuals' health and well-being, but during COVID, it was never as easier to find support as it was through those community groups. It was fantastic. Everybody wanted to give and help and support their community, and that's how the 112 community groups were established. So the referrals were coming into the Community Connector service, as I said, for support for individuals. It was a coordinated approach through health and social care to find that support, and it was mainly through the Community Connector service we were finding that support. We were feeding that information back into health and social care, so they had the understanding of how the community was responding to the needs out there. So it was really great. And also through that, then there was a recruitment of formal health and social care volunteers to help support where the demand was going to be, and at that time we didn't know where demand will be, and I'm sure Claire will go on to talk about that a little bit later. We recruited them for transport volunteers, for volunteers that could go in and do formal support in hospitals, in catering, delivery of equipment across the county. So there was formal volunteers recruited and formal volunteers to collect prescriptions as well, because we were quite aware of some of the medication we were expecting volunteers to go and collect from community groups was controlled drugs. So it had to be done in a professional way of recruiting, safe recruiting of volunteers to be able to go and collect those prescriptions for us. We also provided essential information to individuals of where the support was out in those communities, of those community COVID groups as well. But we also sourced funding through the Regional Partnership Board of funding to support any expenses those COVID community groups had as well, for going and delivering shopping, for purchasing any equipment, PPE equipment and things like that. So we were then able to distribute funding to those community groups based on the activities and the needs that they had as well. There was welfare packages provided by some community groups. There was essential food shopping supplied by some as well. And our food banks as well in Powys really ramped up the delivery of what they were providing. And they were a great part of the emergency response team as well. But that was a complete coordinated approach through health, social care and the third sector. So the Community Connector Service, Claire, if you could just go to the next slide, please. The Community Connector Service, as I said, had a huge demand. Prior to COVID, we would see about 230 to 250 referrals a month coming into the 13 connectors. Between April the 1st and March 21, we had over 7,341 referrals into this service, which was huge. It was averaging out of over 600 per month, but as April alone was the highest demand, where we had 1,633 referrals in for support. So without that community sector response and those community groups, we would not have been able to have met that demand. It was huge, it really, really was. But as a partnership approach, as we've already highlighted, we were able to meet that demand as well. You can see the breakdown there of where the referrals were coming through. We had over 3,000 from adult social care and from the welfare calls that were established. Welfare calls were made by Powys County Council, ensuring people had shopping, prescription collection or somebody to talk to. No. Through those welfare calls then, there were referrals made into the Connector Service for any issues that were highlighted. If there was a need for support with shopping or prescription collection, or they had nobody to talk to, anxiety is extremely high, the referral came into the community connectors, and that's when we went to the local community to get that support from for those individuals. A lot of individuals got referred over to the Powys Befriending Service, another service that's overseen by PAVO. That service responded to the need by recruiting telephone befriending volunteers, and those volunteers made weekly phone calls to those individuals that were isolated, alone, and had no friends or family to call them to ensure that they were okay every week, and to befriend them, to offer them that weekly call as well. So we had a huge increase of self-referrals into the service as well, people looking for support from their own communities. 2,537 self-referrals into the service, and self-referrals overtook referrals from other organisations for the first time ever into our service. People were looking for their own support to help overcome health and wellbeing issues to them as well. We had referrals in from health, from GPs, but obviously people were quite anxious not to put pressure on the health service, so referrals in from health were lower during that period. And we also worked on a project, a homelessness coordination project. The Welsh Government had the policy of everybody in and everybody had to be housed during the pandemic. And so there was a coordinated approach in Powys, a homelessness cell approach, where it was health, local authority, housing department and the third sector to coordinate this approach of ensuring everybody had a home during the pandemic. There was weekly meetings, discussions regarding individuals, and support were found for individuals with whatever presenting issues it was, whether it was benefits, access to food, access to furniture. Majority of that support came through the third sector for those individuals. And we worked on that project for over 12 months, and we still have very good working relationships now with our housing department in statutory services and housing associations as well. So that relationship is really built over the time. As you can see, the demand on community and voluntary sector for support for our clients was huge, and over nearly 12,000 requests or signposts were made to the community or voluntary sector for support for clients. And without the third sector, I'm not sure where we would have found that support or where people would have gone, but the third sector and community groups really did respond during the pandemic, which was fantastic. We did over 900 signposts into private or businesses for support. And then you can see there was 1,480 referrals or signposts to statutory services. So it really was the third sector and community that responded to the need of individuals during the pandemic. But it was that partnership approach of the statutory sector working with them to find that support for individuals. So what did our clients say on the support that we provided them through the Community Connector service? 100% were satisfied with the service they received. They said they were treated with dignity and respect and supported. They said that they were able to access information. 90% of them said the community was able to support them with their health and well-being. And 96 said they were responsible for their own health and well-being. And we had a quote from a lady. She was struggling to get meal provision, so we found the community support for her and the local cafe that was responding with the community group there to provide meals. And she said she was really enjoying the meals that we'd arranged for her via the local social enterprise initiative. She looked forward to eating again now, as they're so nice. I can't cook for myself anymore and was bored of frozen food. I'm now in such a better place and my mood has increased. And I actually look forward to Christmas because of this change. I've already placed my order for my Christmas lunch. She said I was at a bit of a loss about what to do, to be honest. If the connector hadn't got back to me when she did, I'd have just left it because I was so frustrated at the time. Lots of professionals were telling me of who to speak to with, but it just wasn't working out for me. The connector really helped and she put me in touch with exactly the right people to help with my situation, and that was the community. So that was really good feedback that we had there. So Claire, I'm going to hand back to you now if there's no questions on any of that.
Thanks, Sharon. I think it's really important as well to say that partnership work, I don't think we'd have been able to respond the way we did. And also within PAVO as an organisation, we had to redeploy staff from our development team, buddy them with connectors. So they got to learn new skills as well. And it really helped build that relationship across our organisation, particularly when we're working across the whole of the county. And in terms of that as well, when the demand was at its highest, we were having those regular conversations with our statutory partners, and we actually had library staff redeployed to help us as well to meet that demand. So 3 library staff came in and helped us in terms of taking the welfare calls and the referrals that were coming through. And that was a really great piece of partnership work. Okay, so the Social Value Forum, we've talked about PAVO and the context of PAVO and that initial emergency response. And within that period as well, what we had just prior to COVID with the 13 connectors, we'd had a number of connectors that were delivering locality network meetings. So it wasn't the whole of the county at that time. And what those meetings initially were about were bringing professionals together to have a chat, learn from each other what they were delivering, and then they'd have that knowledge, that networking and that knowledge sharing. So in the midst of the pandemic, we decided that we needed to extend that across all 13 localities and set up the locality network in each of those areas and extend its remit really. So it was about delivering that networking opportunity, but expanding who was to attend. So really small groups, local community councils if they wished, anybody with an interest in social value. And that was an opportunity for them to come together, understand where the unmet need was, encouraging groups to work together and perhaps submit applications to the Social Value Forum funding that we had through the Regional Partnership Board. And really see what the community can do to develop and offer health and wellbeing support. And that in essence has turned into our social value forum. So previously we used to hold a quarterly meeting of third sector partners to come together and discuss social value and what that might look like and how we might deliver things. But now we've developed out of CSIRT, the CSRG, so the Community Sector Response Group. So as part of the Social Value Forum, we ask for a nominated representative from each of those 13 localities to come to the CSRG group. And that's what I'm going to talk to you about now. Okay, so the objectives of the Social Value Forum in Powys is networking, as I've mentioned, really important to network, and encouraging groups and individuals to help find those solutions. And it's around enhancing support and the implementation of the Social Services and Wellbeing Act, strengthening links to legislation and other policy priorities, and really making that understanding. Co-production, and we often hear about co-production and its thread throughout all of government policy. But in the Social Value Forum, we develop and promote opportunities for alternative methods of delivery. So there's opportunities to discuss that and what that might look like on those locality basis rather than a Powys-wide model. And encouraging groups to come together to provide preventative opportunities to social care and wellbeing services that improve wellbeing outcomes. It's around community engagement and increasing that knowledge and understanding of what the community can offer and the role they can play in supporting individuals. And it's about gathering that information from those locality basis and feeding that into wider policy decisions and plans such as the population needs assessment and the wellbeing assessments. So as I mentioned, the Community Sector Response Group was set up on the back of CSIRT. So CSIRT ceased to exist and the Community Sector Response Group started up. So it's across those 13 locality networks, and the locality networks are delivered by the community connectors in each of those localities, and they are supported by 2 network development officers. So those development officers are there to encourage more groups and people and businesses to attend, but also to support groups that are coming together and might want to work together and not sure how to go about it. And we have Hayden, who is our social value officer, who is part of the Social Value Forum and oversees that and helps facilitate the grant funding through the Regional Partnership Board for the Social Value Forum. So on the CSRG group, it's chaired by the PAVO CEO, but as I say, made up of those nominees from the locality networks, PAVO staff, Powys County Council, the Health Board, and then citizen reps from the Regional Partnership Board and the carers reps as well. So it's about having that conversation around what's going on the ground and really trying to influence decision making around the Regional Partnership Board. So rather than that top-down approach, it's about getting those voices from those localities and feeding that up and showing the difference that communities can make in community action. And also it's about understanding the unmet need and how communities can be enabled to help support that. So we're now going to talk about volunteering, which is a real key role of the CVCs, as you know. And Claire is our senior officer in the PAVO development team and oversees the Powys Volunteer Centre. So I'm going to hand over to Claire.
Thank you, Claire. Morning, everybody. Hope you're doing okay. So obviously, I mean, Powys has got a hugely proud tradition of volunteering. And just, you can see the figures on the screen there, you know, 37% of formal volunteers in Wales. How many formal volunteers do you think there are in Powys? So in the chat, just have a guess, have a stab in the dark, see what you come up with, and I'll be interested to see what you think that figure might be. Don't be shy. Sharon and Claire can't do it because they know the answer. Anybody want to have a guess? Thank you, David. So these are the formal volunteers. So those volunteers that are attached to an organisation. Any more for any more? No? Here we are. So I will put you out of your misery now. Let me get my notes up. So in Powys, we have 64,611 formal volunteers. So some of you are really close to the mark there, so well done, which accounts for 58.3%. So I'm going to ask you the same now for informal volunteers. And so that's people who get unpaid, giving unpaid help to, as an individual, to other people, not relatives, but so like say if I went and did my elderly neighbour shopping, that would be informal volunteering. So any oh, Teresa, oh, you're anybody else? Right, so informal volunteers, Teresa, you were spot on. So if I had a prize, I would give it to you. It's 75%, so 83,071 informal volunteers in Powys. And given that, you know, the population of Powys is around 132,000, I think. So, you know, around half the population of Powys volunteers in some shape or form, which is quite extraordinary given the rurality that we're surrounded with. And that's just the ones we know about. And lots of people don't even think that they are informally volunteering. So quite interesting. And the biggest groups of volunteers in Powys are 16 to 24-year-olds and 65 to 74-year-olds. And what we also find is that you'll get volunteers who volunteer for a number of organisations. If you know, they're saying if you want to get something done, ask a busy person. We find that very much with a lot of our volunteers. So as Powys Volunteer Centre sitting within PAVO, we work with individuals, voluntary and community groups and public sector agencies to promote volunteering, to help organisations recruit volunteers, help individuals find volunteer placements and support good practice and volunteering. And we operate in conjunction with several delivery partners around the county to ensure comprehensive geographical coverage and to address local volunteering needs. And, you know, in Powys, throughout the pandemic, we've seen the most extraordinary volunteer response. So we've been building on the partnership working with our statutory colleagues in the Health Board and County Council that we built up through CSERT. And we've worked very closely with them around the recruitment of formal volunteers to support health and care services since the commencement of the pandemic. And at that time, we met on a weekly basis to, you know, identify possible placements, any issues, etc. And we placed a number of volunteers with the Health Board and County Council, including end-of-life companion volunteers, library home delivery volunteers, and mental health buddies. And some of the opportunities that we did plan with our statutory sector colleagues didn't pan out as we'd expected, and we're looking at how we can overcome these moving forward. And now that we're coming out of the pandemic and the restrictions are removed, we're finding that recruiting volunteers is a challenge at the moment for small and large organisations across Powys, and we know that that's reflected across Wales as well. The volunteer environment is changing. You know, volunteers are tired, people are going back to work, volunteers are still wary of COVID, and they might be reluctant to go back to any previous placement they had because of the way in which they operate has changed quite significantly. Okay, so one project that built on our partnership approach with our statutory sector colleagues is our fabulous Wayfinder marshals at the mass vaccination centres. You can see some lovely pictures of our wonderful volunteers there. We're working really closely in partnership with the Health Board to provide volunteer support for the 3 centres around the county, which is spread out quite significantly for us. And so our Wayfinder marshals, you'll see from the pictures there, they provide a cheery face for anybody attending for their vaccination appointment. So just some baseline stats for you really. Since December 2020, we've had 428 volunteers sign up for the opportunity. We've currently got around 206 active volunteers that are there, and a total of 28,567 volunteer hours has been given, which is just the most phenomenal figure. That's the equivalent of 4,081 working days at 7 hours per day, and the equivalent of 816 weeks at 5 days a week, 7 hours a day. And when the programme first started, the centres were open sort of 8 till 8, and volunteers were there covering all the shifts. It really was phenomenal. And it was a really fast-paced recruitment exercise for us, working with the health board. And, you know, we got people on the ground within a week to 14 days of us advertising. It was really fast-paced. We undertook the recruitment, the onboarding of volunteers. So we undertook the DBS checks and made sure the volunteers did their training that was required. And we also actively manage the volunteer rotas for each site. We undertake supervision of volunteers on a quarterly basis, with the health board being responsible for day-to-day on-site supervision. And I keep saying it was the most extraordinary response to the call in December 2020, and some of our volunteers have been with us for over a year now. They're there every week. They turn up in all weathers to support the mass vaccination programme. And obviously with the booster announcement that was made late at the end of last year, again, we had another great response to our call for more volunteers to help with that, with an additional 100 volunteers signing up to help, which was quite extraordinary. And, you know, PAVO at the moment is about 77% of boosters have been administered, and the volunteers have played a really integral part in making this happen, and have played such a hugely important role in supporting the vaccination programme. The volunteers are happy to tell us how this volunteering opportunity has changed their lives. They've informed us of the range of physical, mental and social benefits of volunteering. Myself and Sharon are Wayfinder volunteers. We've both loved helping out. It's been absolutely fantastic. And you know, the benefits of volunteering were particularly apparent at the start of the programme. We were in full lockdown. People were just glad to get out of the house, to go and do something proactive and help people at the same time. It was absolutely phenomenal. And some added value of the volunteering, we've got 3 of our volunteers who've gone on to paid employment with the health board, which is just fantastic, because we know that volunteering is a pathway to employment. So moving on, building on what we've achieved with the mass vaccination programme, we're now supporting the recruitment of hospital support volunteers, and this is the first face-to-face opportunity since the commencement of the pandemic. So that's really exciting that we've been able to move that far. We're recruiting volunteers for 5 local community hospitals, and it's a non-clinical role. The volunteers will be acting as a motivator or a befriender to support the patients and staff of the ward. And we're working really closely with Neathport Talbot College, because obviously with their health and social care students, they've missed out on work experience and volunteering placements because of COVID. So this is a really exciting opportunity for them. We've got around 20 volunteers that we're currently processing at the moment. So on to the Health and Care Academy now, and this is just a hugely exciting development in Paris. The Academy is going to increase local access to education, training and development across the health and social care sector, specifically focused on the workforce in Paris. And it's a key programme of work within the Paris Workforce Futures strategic framework. The Health and Care Academy has been set up by Paris Regional Partnership Board, who are working together through the Academy to improve the access to education, training and development and available careers within the sector. And it's going to operate as a hub and spoke model. The hub is Bronclease. You'll see the picture there of the building there. That's the Health and Care Academy. And it'll offer state-of-the-art practical, academic and digital learning opportunities through the 4 schools of the Academy. So there's going to be a school of professional and clinical education and training, with the focus on giving learners the opportunities to gain professional and clinical skills and expertise in modern simulation environments, embedding peer support and collaborative working. School of Research, Development and Innovation It's focusing on equipping the county's health and care workforce with the skills and confidence to identify improvements needed in their areas and to systematically make those improvements, measuring and demonstrating the impact. The School of Leadership is a focus on development of leaders across the whole health and care system in Powys. And then finally, the School of Volunteers and Carers, which we're really excited about. And this will focus on providing education and training and development support to volunteers and carers as a core and important part of the broader workforce. And we're currently undertaking further work to build up the offer of what that looks like and what volunteers and carers will be able to access. So, but through this offer, we will be developing quality volunteering opportunities within the sector, raising awareness of and enhancing and celebrating the value of volunteers, improving accessibility of volunteering opportunities, promoting best practice in working with volunteers, helping volunteers to understand how volunteering can help them. And this is really important, helping them to identify their transferable skills, explore the options available to them, provide resources to increase their skill sets and identify career pathways through a skills matrix. And the school will also offer a range of opportunities to connect with others through virtual and face-to-face forums and provide opportunities for focusing on volunteer and carer on health and wellbeing through courses and resources. And as well as the broader academy, there's an adaptive simulated living space that's currently under design and development, which will provide access to adaptive living spaces where volunteers and carers can see the latest home gadgets and technology that support people to live independently. And there'll also be the development of the outside space will be the final phase. And I've been very lucky. I've actually been to visit the academy. It's the most inspiring space. They've done an amazing job of it. So really excited for what we're going to be able to offer our volunteers and carers moving forward. Thank you.
It's great, thanks Claire. And I was saying a little bit earlier that it's wonderful to see that site is being repurposed and reused. Several years ago now as a county councillor, and there was talk or concern that the site would close and the buildings may end up in the same fate as the old hospital in Talgoth, but it's wonderful now that so those old buildings are being repurposed and being looked after for the future and offering new opportunities to people as well. So it's really exciting. And of course, with the use of technology now, you know, we can offer so much more, can't we, from a site. So looking forward to see that developed. And I think it's really key that we've had that be developed to include the School of Volunteers and Carers, which I think is a real bonus, and I think it will really offer those opportunities to volunteers and hopefully encourage more people to volunteer as well around health and care and develop the workforce going forward. So that's really exciting, and I'm sure, well, maybe in 12 months' time we can do another session about what that is now delivering and the difference it's making to the volunteers and carers as well. So we spoke a lot around how we got to develop CSIRT and what we offered during that COVID time, and hopefully we're starting to move out of that pandemic. But I think the one thing we have taken from that is that partnership working, and that's certainly something we don't want to lose. So we want to take the learning from that and to continue to develop it. But some of the other work that we are doing in terms of post-COVID and supporting people and communities to feel safe is through the CVC work that we're delivering. So that ongoing support to individuals and groups and increasing volunteering opportunities, as we've heard, that continued work with statutory partners. And I'm sure, I think there's another slide where Sharon will tell you about what we're doing in terms of that work with statutory partners and health and care. But networking is really vital. So we've talked about the locality networks, but that is just one part of the networking opportunities we deliver. We also offer a number of other opportunities to network and bring organisations and people and communities together. And there's just some of them there. So we've got our dementia network, mental health providers, agri-wellbeing, which I think is really important in a rural community to talk about the needs of agricultural communities. Quite often, the farming community in particular, maybe not speak up quite as much as they should around their needs, around their health and well-being, and in particular their mental health needs. So that agri-wellbeing network really focuses on that and bringing support agencies together and promoting those opportunities. And we're looking forward to getting back into the local agricultural markets as well, once we're able to. We support the Powys Advocacy Network and another one, so the community transport. So Claire has worked very closely with the community transport schemes across Powys in terms of getting people to the mass vac sites, because transport is an issue here in Powys. So there's a network of those transport providers. And village halls, this has been a huge piece of work for a colleague in PAVO in terms of offering village hall support around returning to offering services from their buildings and doing so in a safe manner. And that is one of the networks that has really grown and developed over COVID. And then we also support Trustees Network and Volunteer Involvers Network as well. So we continue to do lots of information sharing about best practice, COVID safe return, and supporting communities through our bulletins and blogs. So we have a PAVO bulletin, we have a health and wellbeing bulletin and a mental health bulletin as well. And they go to a wide range of people and communities and groups. So they're able to access information and find what they need to know easily. And that grassroots networking through our network development officers as part of the Social Value Forum, so CSRG, it's really getting to know those communities and those individuals in those communities that can support health and wellbeing and health and care. So I'm just going to touch on social prescribing, and I'm sure you all know that social prescribing is a huge buzzword at the moment in terms of delivery and in terms of Welsh Government programme for government as well, where they have asked around delivering a national framework for social prescribing. So we know that there's many multiple models of social prescribing in Wales, and we very much champion that community connectors are social prescribers. They come under lots of different names, so community connectors, social prescribers, local area coordinators, and they have different names and slightly different functions based in a variety of settings, and they have different funding models. So you can understand that there is quite a challenge out there. And I've been working with colleagues at Whisper for the Wales School for Social Prescribing, looking at those different models, and they have written a report, and the link is there, and we'll try and put that in the chat pane if we can afterwards, around understanding social prescribing and the different models that are available. So as part of a group with Welsh Government and Public Health Wales colleagues, we have been working on delivering and designing this model here, which looks at all the different aspects of social prescribing. And I'm sure you'll recognise many of that. So focusing on the what matters, co-producing with individuals, solution-focused, strengths-based, empowering, the connection to community assets, which are vital. So I think one of the key messages I would like to give is that whatever model you're delivering in terms of social prescribing or community connecting, the value of the assets in those communities is key, and without continued growth and funding for those smaller assets and community-based assets, you know, we're not going to have the offer that we have now. So it's really underpins that and really fundamental to the delivery. And it's about ensuring as well that we understand the feedback and develop and grow services going forward. So linking through with GPs, and we know that in some models it's very much focusing on that GP, that clinical offer, but for us in Powys we very much see it as a holistic model. So we take referrals, as Sharon has said, from health, from social care, from individuals themselves. We've done some work with the police and fire service as well, for example. So it's really that no wrong door approach to supporting an individual to access the right support at the right time in their community. And there is that definition there taken from the report. So social prescribing in Wales is defined as connecting citizens to community support to better manage their health and well-being. It is person-centred approach to empowering an individual to better manage their health and well-being through a number of activities. And for me, it's about being able to have that what matters conversation and really understand that individual's needs. It's not about pigeonholing them into certain organisations or certain services or activities. It's about working with them on their strengths and understanding that what matters and what they would like to achieve and supporting them to do that. So in terms of the policy context, as I said, we will be seeing the National Framework for Social Prescribing coming out, and I think that will be coming out to consultation hopefully February, March time. And we know that wellbeing is at the forefront of health, social care, public health and third sector agendas, and it's central to key policies and legislation. We of course have the Wellbeing of Future Generations Act and the Social Services and Wellbeing Act as well. And we understand how wellbeing is a real growth area, and it needs to be understood and enhanced and promoted across Wales. So social prescribing provides a mechanism for furthering these agendas, and it's around setting the wellbeing goals and looking at those within the acts, and facilitating working across health, social care and third sector to achieve a preventative and holistic approach to the population's needs. I think there is more to do in terms of that preventative model and that preventative approach to people's health and well-being, and social prescribing can play a key role in that. So in the connected community strategy around loneliness and isolation, and myself and Sharon were on a meeting with social services colleagues this morning, and we were saying that one of the biggest presenting issues into the connected services around loneliness and isolation, and we know the detrimental impacts that can have on individuals. So the strategy is committed to supporting development of social prescribing, and it's looking at 4 deliverables. So working with regional partnership boards to identify the number and functions of social prescribing across Wales, developing a national skills and competency framework for social prescribing workforce in Wales, and we're hoping some of that work may well feed in through the Health and Care Academy in Powys as well. They're also looking at developing and launching an online resource portal to support social prescribing activities. And I know there will be questions raised around that because there are a number of portals already out there. So those conversations need to continue around what that might look like and what is the best use around that. And fundamentally, it's about continuing to work in partnership and developing the evidence base and the outcomes framework. So really seeing how community connector type models in Powys, for example, and other areas can deliver social prescribing, and work with other agencies that are also delivering different types of models around social prescribing, such as green prescribing, for example. So we try to work with other organisations that are delivering that green activity in Powys. And we've also worked closely with the likes of Brecon Mind that are delivering a mental health focused social prescribing service in Powys. So it's very much about that partnership working, not just with health and care, but with communities and with other third sector organisations as well. So exciting time. Please keep an eye out for that framework coming out and that consultation around the framework. And we'll continue to feed in a third sector perspective to that group work. And I'm sure many of you that are from local health boards and statutory organisations will also be feeding into that and looking at how we can develop that across Wales going forward. So we're now going to talk about how we work with health and social care effectively, and what that might look like for the future and what the challenges have been and might be going forward. And just to give you a bit of context before we got onto that, I mentioned earlier about how the service has grown, in particular the community connectors, but that whole partnership approach. And just to give you some context, when I started, there was 2 of us as third sector brokers. I remember being excited when we got 50 referrals in a month. It was like, oh my goodness, 50 referrals. So we're on the up here. But now it has fundamentally become part and parcel of the health and care approach within Powys. And we do that through a number of mechanisms. And I'm going to hand over to Sharon to tell you how we do that and the work that we're taking forward now in partnership.
Thanks, Claire. So we really have got a complete partnership approach now within Powys. As Claire said this morning, we were on a meeting with the senior team for social services, discussing the work that we're doing with them currently and giving them updates on the work that we are supporting them with. And one of those areas of work at the moment is welfare calls to individuals that are waiting for packages of care, because I'm sure you're all aware there is such a shortage of care provision across Wales, and in particular Powys. It's a very rural county. It's there's pockets of areas in Powys where there are no care provisions at all. So those individuals that are waiting for packages of care are receiving a weekly welfare call from the Community Connector service. That weekly welfare call is checking that they are well. There are no issues that we need to report back to social services. They're able to get shopping, prescriptions, they've eaten. They have somebody that is calling them. They're in contact with others. But if we highlight any issues or concerns, the connectors are then working with them to find that local support, that shopping, prescription support, highlighting any issues back to social services, I said, if they're not eating or drinking, but are ensuring that they're having social interaction with somebody as well to improve their well-being. So we're working with our befriending service as well to ensure they're having, they've got a friendship group that are supporting them, whether that's a family, a friend, or a volunteer. So that's part of the partnership work ongoing. We attend daily delivery coordination meetings with health and social care colleagues. Those have been since the pandemic issues prior to Christmas, where regulations came back in place and pressures that were put on health and social care and the third sector, ensuring that where there are pressure points, they're discussed and there's a coordinated approach to overcome those issues. And whether it's discharging individuals home from hospital with that extra bit of support, or it's support where staff has been affected, that people are all aware in that partnership approach of where there are pressure points and working together to overcome them. So it really is a partnership approach of overcoming any presenting issues throughout the county. We attend GP primary care cluster meetings, inputting information from third sector, from community groups, and working with our primary care colleagues to ensure that we've got the best approach going, whether that's training up doctors, receptionist staff when they're doing their triage calls in the morning to individuals. So if it's not a relevant referral or appointment with a GP, they are signposted to the Community Connector service to get the support from the community sector, which is great. And that work is developing all the time. As I said previously, the homelessness cell call that we did previously, that work is continuing to develop. We work very closely with our housing colleagues in statutory sector, finding that support through the third sector for them. We attend weekly meetings in with other colleagues from other third sector organisations, with our statutory colleagues as well, looking at individuals and putting support in there. We attend twice weekly patient flow meetings, discussions on hospital discharge plans for individuals, and we're inputting third sector information into those hospital discharge plans, working closely with our Red Cross colleagues, home from hospital support. We attend social services screening panel meetings first thing every morning. Those are calls that come into the adult social service team, front door team, colleagues from various departments within health, OTs, community support groups and teams, social workers, reablement teams, and health OTs as well attend. And it's who's best placed to support the individual that is called into that front door service. Very often it's a referral that comes, a primary referral across to the Community Connector service, but we work really closely with an OT and we go in together to give that support to that individual. So it really is a partnership approach to giving support across. We support the D2RA Home First team as well, giving them information on third sector, and again doing that partnership approach, that partnership working with them, with that individual, stopping them from becoming an inpatient in hospital and giving them the support at home. And that's a really good partnership approach, and there's been some great successful outcomes from that approach as well. And we have really regular cross-section meetings with health and social care, whether it's the adult social care team in the north or the south, or the OT teams across Powys. We're regularly meeting with those individuals, inputting what we do as a service and how we can support them as professionals and how we can support their clients as well. We've just been updating them really on the winter pressures support that's from ourselves and also from third sector in Powys, and they find those really beneficial. We inform them all the time of the support through the third sector. And then, as Claire said, those formal volunteering opportunities have increased greatly across Powys, and it's great to see that we've now got volunteers being recruited to go into hospital to help with any issues that those individuals that are currently in hospital facing. And again, we're trying to improve the knowledge of our volunteers right across, so they know as well where they can find support for those individuals that they're supporting. So I'll hand back to Claire now after that update.
Thank you. And I just wanted to touch on some of the challenges, because I'm sure people are thinking, well, you know, it sounds great, but how does it happen? It can't be that simple. And it hasn't been simple. It hasn't been without its challenges. And I think the biggest challenges have been able to overcome information sharing, because that's really pivotal. So in particular with the connectors, what we have had to do is work very closely with our council colleagues for connectors to access WICAS. So we have the team on there as a team which can refer people through easily from social services, for example, and in particular the welfare calls we were talking this morning around. When individuals are referred to us through WICAS, we're able to update their notes when we've had conversations with those individuals. So it enables a social worker to see exactly what we're doing as a service, and what support we're pulling in from the third sector to wrap around those individuals as well. So certainly information has been a challenge. I think the growth of the service has been a challenge in managing that demand, particularly over COVID. And we wouldn't have been able to do that without having some fantastic colleagues in PAVO, but also, as I mentioned, across sectors were able to come in and help, particularly from the library service. And that understanding, so that regular meetings, that regular point of contact with our statutory providers and with the Regional Partnership Board to understand what the situation looks like on the ground and to be able to respond rapidly and effectively. I think that's one value of the third sector, is that being able to respond perhaps without the red tape. And I think we all agree that during COVID, where some of the stuff was eased up a bit, we were able to respond much more quickly, and that helped us to manage that. Some of the other challenges, often people say to me that people say, oh, third sector as in third place, or maybe not professional. And it really has been around building those relationships and that understanding of what third sector and communities can offer, and the quality of that offer, and ensuring that consistency of approach, and building that trust in terms of the third sector with our statutory partners. And, you know, Sharon's just given you a list of initiatives that we are delivering and working with our statutory colleagues on. And I don't think 4 or 5 years ago that would have been possible. It really has grown and developed, and we hope that will continue. You may have some questions about challenges, so please do put them in the chat box. And that's the end of the actual formal presentation. So diolch yn fawr, thank you very much. And we have a little bit of time left, I think, Clover, for any questions. I don't know what activity's been happening in the chat pane, but I'm going to stop sharing and see if there are any questions.
Wow, that was amazing. I essentially could have gone on for another hour. But I look forward to when we have an update on the Academy, that actually be in person, that perhaps we can have a tour of the Academy. Looking forward to those days when you used to be able to connect on a face-to-face basis. But thanks, Claire's and Sharon, that was great. Whistle Stop Tour. We will be posting all this material later, but just to, does anyone have any questions? Catherine, you mentioned something about what organisations are the drivers, the Health and Care Academy. Did you want to come in on that?
Yeah, I was just really, really interested in such an innovative organisation, really. And I was just looking to see who, A, whose idea was it, and B, who actually drove it forward.
I'm looking at Claire, one of us is going to answer.
It's driven by the RPB, so Board Council, PAVO, and then there are other organisations on the RPB that deliver care. I think Pobble are on the RPB at the moment, Public Health Wales. It's got citizen representatives, so it's a real partnership approach to, you know, making a huge difference to health and care employment in Powys, really.
And one of the things as well that we've done as part of that Workforce Futures, which is the overarching plan, is recruit people to the Kickstart scheme, which I'm sure you're all aware of. So again, that's done in a partnership approach around that, and being able to provide those skills and those opportunities to young people. We're hoping that will all filter through into the academy as well and deliver more opportunities. I sometimes worry that when we say Health and Care Academy, people think of the Health Board and social care. So it's been really important that we've been that voice of ensuring that the third sector is also involved in that. So it's not just about the CVC, it's about all those third sector groups being able to access those training and learning opportunities as well. So there will be a big piece of work around promoting that going forward. And I know within Claire's team as well, they're doing a bit of a skills check at the moment around the third sector and what skills people are identifying that they need. So we make sure that we filter that voice into the academy around its offer. Thanks, Catherine.
That's great. Thanks, Catherine. That's really useful. Do we have any more questions? Because I've got a few, and once I start, I might not stop. Any questions from anyone? Okay.
Can I ask something, please, Kevin?
Yes, of course, please do. Who's
I was
that
going to put
then?
in the chat. I was going to Kevin Fear from Cardiff Council. Hiya, all right. Really interesting. I have to say, you're doing some great work there. It's brilliant. I just want to pick your brains about the Cares Academy again, please. Do you have links with employers then, once the people have gone through the training, to kind of place them with local authority care providers, or what happens to the person once they've completed their training in a shiny new swanky building?
Yeah, it's very much about working with employers. As you can imagine, the biggest employers in Powys are actually the Health Board and the local authority, but linking with other opportunities as well. So thinking about private business, for example, in particular, then working with the commissioning teams that are commissioning in care providers, so our domiciliary care provision, and the provision through the Health Board as well. So it's about linking with those and making sure that they understand the opportunities of one that are available to their staff, but also that we're trying to develop this homegrown new workforce coming through. So from the college right up through to the academy and then to those work opportunities. So yeah, definitely hoping to develop that further. And let's face it, we all need to see our care workforce grow. So if we can really promote that as a really worthwhile opportunity and real important skill that we need, then we're hoping that that will overcome some of those other issues further down the line, really.
I think that's brilliant. I think that because that's for us, you know, as Cardiff Council, we do lots of different projects across the city in kind of various guises, but I think it's the pathway, isn't it, from someone starting somewhere and then they have an end point. There's no point in putting them through something if there's not going to be anything for the person at the end. That's kind of what we were on. So that's brilliant, excellent work.
Absolutely, and certainly we've seen that, as we said already, through volunteers that have come forward and gone on to paid opportunities, which is fantastic, but also by linking really closely with the college as well and making sure that young people that perhaps thinking about embarking on a health and care career, but not sure where to go with it, that they're able to access training, but also access those conversations with staff from the different elements of delivering health and care, and give them options then of where they might like to take those skills.
And again, that's the value of the volunteering as well, isn't it? If somebody's doing befriending visits, potentially, they might think, oh, I quite like this, I could do this a bit more formally as a job, and then they got a pathway into the care academy and then into paid employment.
Yeah, absolutely. And Claire knows some of the feedback that we've had from people already saying, you know, they've now gone on to do other things as well, and it's really given them confidence, which is fantastic, really. I think if we all look back at ourselves as youngsters, I dare say we all had varying degrees of confidence when we were 18, but being able to have those opportunities early on and that support and that mentoring as well is really important.
Excellent, thank you very much, Claire.
And it's not just about youngsters either, it's about anybody who's thinking of a change of career at any point in their, you know, in their life, that, you know, that health and social care is an option for them, and there are pathways to follow, and this is how you do it, and this is how we'll support you. So it's really exciting.
Brilliant, thank you very much.
That's great, thanks, Kevin. May I ask Sharon a question? One of the things that Sharon was covering was around community connectors, being the eyes and ears in communities and knowing what's going on. And what we found in some of the case studies is actually How does the good practice travel? What are the personal challenges or the locality challenges, and how do you adapt to them?
That is something actually that we've addressed through the locality networks that have been established with the community connectors and the locality network development officers. There's currently 13 of those locality networks across Powys. The background to those is sharing of information, sharing of good practice, and identifying gaps in areas of support as well. That is then coordinated back within PAVO. So good practice shared in Llanfyllin in the north. It's an identified gap possibly in Ystod. That good practice is shared with groups in Ystod of how they've overcome that issue in Llanfyllin. So that good practice is shared right across Powys to overcome any issues.
Right. The other issue. Oh, Catherine's got another question. Catherine, did you want to come in? Thanks, Sharon.
Yeah, carry on, because it's on a completely different track, really.
No, that was good. I think I was just trying to work out how we pick up the challenges of the different localities and how they support it.
Yeah, sorry, Catherine, just 2 seconds. If I just come to that as well. What we were hearing from third sector organisations, they'd come to us saying, "Oh, we're putting in a funding bid to lottery or whichever funding it was." Yeah. But there's this question about evidence, and we know there's a gap, but we've got no evidence for it. So we would work with them then to say, well, the connectors identify unmet need and record it, but so do the locality networks. So you can use that then as actually some data towards your funding bid, and also that narrative from the locality networks that it's been identified as an issue that needs overcoming. So we've certainly seen some of that coming through and supporting those funding bids which have come to fruition, which is fantastic. So it helps the bigger picture.
Absolutely. And Catherine, just one more question, supplementary question on this, which is really around, so you build community resilience, you're working with the communities. What's become palpably clear is the idea that we actually need to think about financial resilience in communities as well, talking about funding bids. Do you all have any thoughts on those?
It's an interesting one, isn't it? I'll link it back to what I said earlier around our services is only good as the activities that are there, and those activities often need that little bit of funding to get them up and running and start delivering. And that's why we've got the development team within PAVO. So they very much work closely with organisations around the funding that they might require around building that business plan and that opportunity going forward. And Claire might be able to tell you a bit more about that, but it's about that full through service. So it's not just about the volunteering and the connectors, that end product. It's about supporting those organisations to grow and develop, and certainly financial constraints are built within that. So if Claire wants to come in about the development offer.
I mean, the development team will support an organisation from cradle to grave, for want of a better analogy, you know, from starting up to thinking about what legal structure they take on board, thinking how they get people engaged with their organisation. Funding is often the sort of carrot that brings organisations to us. Because we work holistically with organisations, we may identify other areas of work that need strengthening. We'll support them around trustee recruitment. Oh, you name it. Anything. I mean, we get all sorts of weird and wonderful queries, which is the nice part of the job. But we are very much about, we can support a group at any stage of their development, and obviously, you know, the financial sustainability is hugely important, and I think something that we'll see become even more important in the next couple of years. I think COVID has hit the sector really hard, and bouncing back from that is going to be challenging. So yeah, it's going to be interesting times, I think.
I think the one thing we are seeing as well is moving towards more co-produced bids for funding. And I know it's that reliance, that funding being there, but pulling organisations together to work together and put one bid in rather than competitive funding approaches. So an example of that is around the bereavement funding that came out prior to Christmas. So within my role then, it's about pulling together organisations within PAVO that may look towards putting a bid into that bereavement funding, and encouraging them to, one, discuss what the gaps and needs were in PAVO, but then to work together collaboratively to put that joint approach in rather than that competitive nature, because that's always going to be the challenge in the third sector when it comes to funding, is that competition. And we've just worked on 2 bids now to the lottery, where we've pulled multiple organisations together to be partners within that bid going forward. So yes, I think that's definitely an approach we need to encourage at grassroots as well. Yeah, so you're on mute, Clover.
That had to happen. Thank you very much. Catherine?
Yeah, well, I suppose it's following on from what Claire just said about grassroots and starting early. It's about social value principles being embedded in citizens at a young age. And I was just wondering about if you did much work with schools in the area.
Okay, well, that's one area which, again, we're hoping to develop. So a number of years ago, we had a children and young people's officer that was funded through the local authority, but unfortunately we lost that funding. And within the regional partnership in Barris, we have the Start Well board, which focuses on everything children and young people. We have Live Well and Age Well. So we didn't have the capacity or the ability from losing that funding to be able to contribute to the children and young people's area of work, really. But we took the decision last year that we needed to reinstate that post and fund that through some of our other funding. We were able to reinstate that post. So what we've developed now is a Start Well development officer, which is there to support third sector groups that support children and young people predominantly. And through that role, Lucy represents the sector on the Start Well board that feeds into the Regional Partnership Board. But she's also really instrumental in working with children and young people to get their voices heard at the Junior Start Well board as well, which is really important. So we've got Junior Start Well members that are young carers, but it's about widening that opportunity. So that's been part of Lucy's role over the last 8 to 12 months, really, is developing that. We don't actually go into schools ourselves, but as part of the team around the cluster, what we do is offer that support through the connectors. Although connectors is 18+, we offer support to parents and carers. But Lucy's role again on that is around getting the knowledge to schools around what's on offer from third sector organisations. I think we've got more to do to encourage that growth around social value and that understanding of community and what community can do and how young people can play a part of that. But I think we're in a strong position where we're going to build on that Start Well role and get those voices of young people to also make their changes and feel that they've got something to say and that they're being listened to. So one of the bids we've just put in for now, again, really about collaboration and pulling people together, is the Mind Our Futures. Very much focusing on what children and young people are saying they want in the county in terms of mental health provision and what they're identifying as gaps, rather than us telling them what we think they need. So lots to do, but initiatives like that I think will really help.
Yeah, oh, good. Yeah,
that's
I think
great.
We're really lucky I think we're really lucky in Neath Port Talbot because we have a youth mayor who is really active and gathering the voices that need to be heard, really. So that's important.
Yeah, and they come forward with some fantastic ideas, and we're hearing a lot as well from our mental health third sector providers around the increased need for children and young people at the moment on the back of COVID. Mental health in schools as well has really been highlighted as an issue, and the third sector organisations are trying to increase their offer of support. But certainly in the Mind Our Futures bid, the voices of children and young people has been absolutely paramount. And Claire also facilitates a number of grant schemes. We've got the youth-led grants, and that's also encouraging young people to apply for funding opportunities to deliver activities and grow volunteering in their communities. But that's is the youth-led panel, so they're youth members making those decisions on those bids, and they are absolutely fantastic. Talk about scrutiny. I think, be careful what I say now, I think some of us might have got to learn about how to scrutinise and affect change. I'll leave it there, I'll get myself in trouble.
No, they are absolutely phenomenal. They are forensic in their assessment of those grant applications, and I'm really proud of all of them, because we've got one of them. She volunteered on the panel, and because of that, she is now lead pupil governor at high school, because she could demonstrate that she could manage her commitments and, you know, read documents and process them and everything. So it's just fabulous.
And on that happy note, I think we probably have to wrap up. Got a couple of minutes just to do that. Can I just say thank you so much, Claire's and Sharon. Do you mind being grouped together as Claire's and Sharon? That was just amazing. Thank you so much. And the passion's palpable. We will be, for everyone, sharing the recordings and any presentations and notes by the end of this week. But keep the conversation going anyway, because you know where they are now, don't you? So you can approach them directly. Yeah, track them down. May I just say thank you very much. Thank you very much for this case study. Thank you to all the people that turned up, and the conversations and the participation. And just remind you that we have another event later on this today, and one more tomorrow, I think. So thank you very much. And don't forget, be part of the partnership. Contact Emma Davis. Thank you very much, all. Thanks a lot.
Thank you, PAVO, as well. So, and the WCVA team that have been behind the scenes, keeping us on track, I think. So,
absolutely.
Thank you to all of you. Have a good day, everyone.
Thanks very much.
Bye.
Thanks all.
Thank you. Thank you very much.